Hi, everybody. Dr. Shook here. Hope you're doing well today. I've had some time to do some research. I've been working with my clients remotely, but I've also had some time to do some research and put together some presentations and follow up with some of the questions that you guys have been asking me from other live streams. And today, what I want to do is I want to share with you something that's really important. I'm going to do this as part of a series of videos, but one thing that I really want to focus on here is with thyroid dysfunction and autoimmunity in particular, because we know the most common cause of thyroid, hypothyroidism and thyroid problems in the United States, around the world, for thyroid autoimmunity is actually that it's due to broken barrier systems of the body and environmental triggers. So I want to talk about autoimmunity and some of the components, the core concepts that I use in practice every single day, so that you can get a better idea of and handle on what drives and contributes to a lot of these problems, and that will empower you and give you, a pathway, a concept of how to help yourself more effectively. Okay, so the first thing that I want to start with is really talking about the barrier systems of the body and how that contributes to autoimmunity and a lot of health problems. So this is, even if someone doesn't have thyroid autoimmunity or hypothyroidism, it doesn't matter if they have metabolic disease, if they have problems with their brain, if they have heart disease, if they have joint problems. There are so many. What I'm going to talk about in this today is such a significant contributing factor to poor health. It is I cannot emphasize it enough. So what we're going to do is I'm going to share my screen with you. We're going to go through, and then I'm going to give you some time at the end to ask some questions if you have anything about this or other questions that might be on your mind. But let's go ahead and get started. So what I want to talk about are the broken barrier systems contributing to thyroid autoimmunity and health problems that no one told you about, because this is not something that is discussed very, very frequently at all. Now, many of you, I'm sure, have heard of the concept of leaky gut or intestinal permeability, or at least I hope you have. If you haven't, I'm going to teach you quite a bit about it in this live stream today. So before we get too far into this, though, as always, this is informational in nature. Before you make any changes, talk to your doctor. This is not medical advice. Hippocrates said all disease begins in the gut. And at least, I don't know if all disease begins there, but a tremendous number of problems begin there. And when we're talking about autoimmunity, there are the conceptual model that I use when I work with my clients is I really look at a functional immunological model. So this is looking at the immune system and how it is being triggered and activated to attack the body, because that's what's happening with autoimmunity. And again, that is, like, we think that 90% of hypothyroid cases. So if you know, or if you're dealing with hypothyroidism, or someone that you know is dealing with hypothyroidism, and they haven't been checked for autoimmunity, they have a 90% chance that their hypothyroidism is being caused by an autoimmune disease. Okay, that 90%, so 9 out of 10 people. And I can tell you right now that the vast majority of people have not been checked for thyroid antibodies. I don't know exactly what the numbers are, but very few people get checked for thyroid antibodies, because the doctors, the primary care physicians, look at it this way: there's nothing we can do about it. So they're just going to give thyroid medications and replacement to try to support the loss of the thyroid hormone output, because autoimmune disease destroys the thyroid gland, causing it to have less capacity to produce hormone. So their idea is, I'm just going to support you as much as I can, try to help with your symptoms, but there's nothing I can do about it. And that's based on outdated information. So today we know that there are many things that we can do, and that we can do immunological testing to help us understand what the immune system is reacting to. There's a lot of different things that we can do to try to unwind this vicious cycle that's occurring, and really focus on dampening that autoimmune process, and try to calm it down so that the body, the thyroid, can heal to its best ability, or so that we can accurately see what its output's going to be. and then try to help the person, to get a better quality of life and get their life back. So the conceptual model that I use really looks at three different things. And this comes from immunology. Okay. This comes from a lot of the work done by Arista Vojvodani. He's an amazing immunologist. And so there are three components here. There are the barrier systems of the body, which is we talked about, and you've probably heard about the intestinal lining, right? So when it breaks down, it becomes leaky or hyperpermeable, which it lets things in through the intestinal lining into the bloodstream before they should be there. And this is a major problem for autoimmunity. The other side of that is environmental triggers. So we know that the immune system can react to partially digested food proteins, to pathogens, which are bacteria, viruses, parasites, fungi. And we also know that environmental chemicals can be reacted to immunologically, and that these things, these foods, these pathogens, these chemicals can actually be triggers for and perpetuators for autoimmunity, because and there are a few different mechanisms behind how we think that this works, but the most common one is what we call molecular mimicry, where your body's reacting to, let's say it's a food protein. It's reacting to something abnormally. Say you're eating a food protein, or you eat food, it starts breaking down in your digestive tract, but because your intestinal barrier is broken down and porous, it lets this food protein into the bloodstream, and the immune system doesn't recognize it, so it starts reacting against it. And the reaction against that food protein, because the food protein may look a lot like your own tissues, can cause the immune system to start attacking your body. So one of the goals that we try to focus on clinically is identify what the body's reacting to, remove that from the body's exposure, try to, if the barrier systems are compromised, try to heal those, and intervene as many ways as we can. Another component is immune dysfunction. So this is the third circle, and support the immune system appropriately, making sure that there's good immune regulation, and that so there's a lot of things that go into immune regulatory function in the body. Essential fatty acids like your omega-3s, vitamin D, vitamin A, antioxidants like glutathione. There are many things that we can check, and minerals, zinc, iron, selenium. These are all critical for normal immune regulatory function. And so many people are deficient in those things. So the immune system's not well regulated in a lot of people. They have barrier system breach, which I'm going to talk about two of the barrier systems in detail. That's broken. So things are getting into the bloodstream that shouldn't be there. The immune system's reacting to them. These proteins or bacteria that are getting into the bloodstream look a lot like the human tissues. So the immune system's attacking your own body, thinking mistakenly, because it's getting bombarded by this stuff from the environment. And then the immune system is not able to mount an appropriate response, because there's immune dysregulation due to things like deficiencies and whatnot. So these are the factors from a functional immunological perspective that we believe contribute to environmentally induced autoimmunity. This is what I work with every day. This is what we work up with our testing to give us the very best starting point to try to unwind this mess that people are dealing with. And sometimes it's easy, and sometimes it's really difficult to do. It just depends on what mix of problems we find. But usually you talk 6 months or so, that's a good amount of time to really make some significant progress with the right information. So what we want to talk about today in this live stream is the barrier breach component. So the intestinal permeability and the blood-brain barrier, which is real important. Okay. So what we're looking at here is this on the left-hand side of the screen. What you're looking at there, that is a diagram that is illustrating the intestinal lining, like really zoomed in if you're looking at it under a microscope, and you're looking at it from the side. So those little purple things that have the hair-like fingers at the top, those are the cells that are lining the intestines. Okay, they call them the epithelial cells. And between those, when you see these things budding together, between them, there are these little lines. Those are called the tight junction proteins. So they kind of keep those cells together, okay? And they work almost as a gate. So when the body wants or the intestinal lining is trying to absorb things that it needs, like amino acids. So you break down food very, very thoroughly, the proteins in there, and it makes amino acids. These amino acids are small enough that they should pass through into the bloodstream so that your body can use them to repair and rebuild. So that's an appropriate thing. It's so these little junctions between the cells, they open up and they let those things through. Okay, the problem becomes that this system can become broken down. Those gates between the cells can become broken and let things that are too big and that should not be passing through pass through into the bloodstream. Okay. Now, also the cells themselves. So if you see this, if you can see it on the screen, one of those purple cells is ripped in half. Okay. Now, this is a more severe form of intestinal permeability or leaky gut. And there's the terms used for this. When the little gates break down between the cells, that's called para, meaning between, paracellular penetration or breakdown. Okay, and when the cell breaks down, it's called transcellular. Now that's a more severe form of intestinal permeability or leaky gut. Okay, and this can happen for a lot of different reasons. We'll talk about that in a second. But we can do testing to assess the severity if this is happening and the severity of this. And it also gives you, it allows you, when you do that, it allows you to get quite a bit of information about the severity of the problem you're dealing with, the potential causes of some of the symptoms that might be occurring. Because when this happens, it lets these proteins and some things, it lets these things that come from bacteria called lipopolysaccharides into the bloodstream. Okay, these lipopolysaccharides, which come from bacteria on inside the intestinal tract, are extremely inflammatory and are the research shows us that they're connected to a tremendous number of problems with systemic health, which we're going to talk about in just a second. So this is leaky gut. Okay, this is actually what occurs here. Now, when the gut wall breaks down and it becomes permeable or leaky, the problem becomes that there's usually an issue with the intestinal flora or the bacteria in the gut. Usually when someone has a leaky gut, they have an overgrowth of bad bacteria. So they have this imbalance that we call dysbiosis. Okay, so it's an imbalance of the bacteria. Most of the time, what you see when we do testing, stool panels, and we do those a lot to assess what's happening locally in the GI tract, we'll find that there's an overgrowth of what we call gram-negative bacteria. Now, the slide that I have up for you shows, you'll see a dashed line. On the left-hand side, it says gram-positive bacteria, which we tend to associate with more beneficial. And on the right-hand side, you'll see it says gram-negative in red. And these are associated with more of the negative or less favorable for our health. Okay, so the gram-negative bacteria, and you might not be able to see it, but if you can see this on a larger screen, it has an outer membrane. This outer membrane is where the lipopolysaccharides are contained. When these cells die, or they release this membrane, is kind of this dead cellular material is inside the intestinal lining. This is called an endotoxin. Okay. This stuff, when it's released in the gut, if your intestinal lining is permeable and it leaks through, it is incredibly inflammatory. I'm not an advocate of animal studies, but I'll tell you that I've looked and I've seen research where they use lipopolysaccharides specifically to induce very significant inflammatory responses in animals when they're doing research. This stuff is bad news. And what I want to show you here is in the center of this diagram, it says LPS, and that's what we're going to use as our abbreviation for lipopolysaccharides. Now remember, lipopolysaccharides are this outer membrane in gram-negative bacteria, which tend to be considered unfavorable. We find them inside the intestinal tract. If your gut wall becomes permeable or leaky, and we're going to talk about reasons for that in a minute, if it becomes permeable or leaky, these bacteria are always dying, but the lipopolysaccharides in their cellular membrane will leak through into the bloodstream, triggering a very potent and inflammatory response. This is not good for autoimmunity. This is not good for general health at all. So what I want to show you on this diagram, at the top of the diagram, it says you'll see it's a picture of a heart. Okay, because lipopolysaccharides have been associated with heart disease. And let me just explain to you, if you have, and so lipopolysaccharides drive up systemic inflammation. Okay, we know that with heart disease, cardiovascular disease, inflammation is not good. So one of the tests that I very, very commonly order, almost almost as a routine. It's one of the most important biomarkers I look at is C-reactive protein, high sensitivity C-reactive protein. If you see, we know that C-reactive protein on the lab report, it says greater than 1 to 3 average risk for cardiovascular event, greater than 3 high risk for cardiovascular event. There's a reason for that. It's because it contributes to plaquing and heart disease and peripheral artery disease. It is not a biomarker you want to have elevated. So we know it's associated with heart disease. If you go to the right, there is another bubble. It says immune system modulation. So these inflammatory markers, they are known to cause immune dysregulation. Okay, this inflammation, this is not a good thing at all for your immune system. If you come down further, it says liver. That is, the liver is placed under a significant amount of burden when there is an inflammatory load. The liver makes the C-reactive protein we measure. The liver has to handle metabolizing it. Inflammation and these lipopolysaccharides place a tremendous amount of stress on the liver. If you go down further, there you'll see a picture of the brain. And this is a really significant marker here. Lipopolysaccharides, when these inflammatory chemicals come from the gut into the bloodstream, they circulate through your circulatory system. And when they get into the vessels of the brain, you have a barrier system in the brain called the blood-brain barrier. Okay, lipopolysaccharides have been shown in the research to cause permeability or opening of the blood-brain barrier. That we know that it occurs. That opens the blood-brain barrier to allow things into the brain that should not be there. This is a major problem, because when the blood-brain barrier becomes opened, if you're letting things into the brain, the brain has a local immune cells called microglia. These cells will react extremely violently to destroy anything that comes into the brain. And as a result, it creates a lot of collateral damage and destroys your neurons, your nerve cells of the brain. One of my instructors once said it's like a chihuahua with a bazooka, and it destroys a ton of collateral and surrounding cells. You do not want an open blood-brain barrier. It's extremely bad things, but the lipopolysaccharides actually contribute to this opening the system and problems with the brain. So we know lipopolysaccharides in this inflammatory load contribute to depression, contributes to gut dysfunction, contributes to neurotransmitter imbalances. I mean, this is one of the primary things. If someone's suffering with depression, you've got to know if they have inflammation. You got to know if their gut's healthy. This is not just a conceptual model. We know that the scientific literature shows us that this is a problem. We know it, and we see it clinically when we work on these things. People feel better. It's also, lipopolysaccharides have also been shown to contribute to flares of multiple sclerosis. This is a major thing. This is not a minor problem at all. Now, interestingly enough, the next bubble is the lungs. So, interestingly enough, research shows that in some cities where there's significant air pollution, there are actually lipopolysaccharides in the air. When you breathe these things in, your lungs, and I'm not going to talk about it in detail here, but the lungs themselves, they are a barrier system of your body. Barrier systems of the body are selectively permeable barriers that let things in that your body can use, and they're designed to keep things out that would otherwise harm the body. So, but the lipopolysaccharides will open the tight junctions in the lungs. So you think about this: your barrier systems, your intestinal lining, your blood-brain barrier, your skin, your kidneys have a filtration system that's also a barrier system. There are a few more, but these are the primary ones. So these barrier systems are selectively permeable. They have to let things in so the body can function, but they're designed to keep things out. When they break down, things can get in that should not be there, and then that can create a lot of problems for the immune system and our health. So the lungs are also affected. If you go around one more, there is the bubble says metabolic dysfunction. Okay, so metabolic dysfunction primarily means this: these increased inflammatory load causes dysfunction of your ability to produce energy. Okay, produce energy. So what does that lead to? Well, just about your body has to produce energy to function normally. Every cell in the body has to produce energy to function normally, to carry out each individual cell's metabolic process. So, we talk about that. It's a systemic thing. It affects all cellular function. But if you really want to talk about metabolism, body weight, I mean, you're going to have a significant amount of problems. When you increase inflammatory levels in the body, you're less sensitive to your hormones, including insulin. So you're going to have problems with blood sugar control, with the metabolism of and use of blood sugar. I mean, this is a major issue. I tell people all the time, when I'm working with my clients, if you have anything driving inflammation in the body, it is priority number one. I mean, it is a huge priority because it will create such systemic dysfunction on so many different levels. You must address the drivers of the inflammation. So when we get into, in the next live stream we'll talk about some of the environmental triggers. We'll talk about the pathogens in foods and chemicals, which are incredibly important to understand what is uniquely driving your inflammatory process. The next thing is the thyroid. Listen, anything that drives inflammation is going to disrupt the thyroid. One of the most common things that we see occurring with, and this happens a lot with the people I work with, because I've worked with a lot of people that have, quote unquote, normal thyroid hormone levels when you actually look at the quantity of the hormone, but they have major problems with sensitivity at the level of the cell. So they'll have things like high C-reactive protein, or they'll be autoimmune, and their autoimmunity has not been addressed. They haven't worked on specific drivers of the immune process. And when you have an active inflammatory process, you will have elevated levels of cytokines. They're these chemical messengers that the immune system makes, and they'll make the cellular response. They'll actually blunt the response of your body to the hormones in circulation. So you can have normal quantities, but you have diminished response. This is a big problem, and that is something that I see happening a lot with people. So that is an issue. You also have, this can create problems with thyroid hormone conversion, so T4 to T3 conversion. I mean, it's a major issue for the thyroid. And then also joint health. This has been shown to create increased pain throughout the body, and including the joints. So lipopolysaccharides are absolutely, I mean, this is something that can just devastate health and be a major driver to poor health. So what causes this, right? So what drives this breakdown of the barrier systems, right? In particular of the gut. So we know that one of the major drivers is stress. So people will ask me, you're like, anytime I'm working with someone, we take an electronic system that asks you a ton of questions. I mean, it's almost annoying because it is such a detailed process, but it helps us to paint the picture and try to understand what were the risk factors that led to the development of the autoimmunity. Were there any triggers that were there? And very commonly, we will see that stressful events occurred around the time that things changed. And stress, so when cortisol levels rise and they're elevated for a prolonged period of time, they impair the ability of the barrier systems to regenerate, so the mucous membranes, these epithelial cells don't turn over as well, and it causes leaky or hyperpermeability. So this stress in and of itself is a potential cause of intestinal permeability. So if you're just under stress, a significant amount of stress, like a lot of us are now, that's why I've been emphasizing over the past few days, hey, focus on the things that you can control. Surrender to the things that you can't. Focus on everything positive that you can, and try to get sleep. Be good to yourself. Drink plenty of water. Do the things that you can do, and don't worry about the things that you can't, because it does us no good, right? It does us no good, and that's important, because under this type of stress, if this creates permeability, or let's say we're autoimmune, but this induces further permeability, well, then food, proteins, and bacteria in our gut, these things could translocate, move into the bloodstream, and exacerbate our problems. Contribute to more. So we really want to try to mitigate stress as much as possible. So that's why I've been harping on, and I did a video on sleep and the importance of sleep, because it is so critical. It's so critical. And then so stress can do it. Long-term bacterial imbalances in the gut, these chronic infections in the gut. So many people have these. I had, and the gentleman was kind enough to do a video. I worked with a gentleman locally who has rheumatoid arthritis. Came to my office, no GI symptoms. We did a stool panel. We found very high levels of 2 different pathogens, 2 different bacteria. No symptoms, not symptomatic. After using antimicrobials. I sent him to his primary care because of the types of pathogens. They used antibiotic therapy, and we combined with what we did. We worked on his health, and he made significant improvement with his rheumatoid arthritis. Great guy, but just an example of how these bacterial infections can contribute to permeability, which leads to reactivity to food proteins and drives these inflammatory processes and immune dysregulation. It is all connected, right? It's not as simple as, hey, I've got a thyroid problem. It's very, very infrequently this simple. I've got a thyroid problem, and I'm just going to take medications, and it's going to be fine. It's not very frequently like that. And if you do take, if you kind of feel like you fall into that category, I've seen people who take medications and then they stop working eventually. And if you have autoimmunity, it does not sit still. It progresses. You can get what's called epitope spreading, where it goes to other tissues. So you got to take this seriously. And if you do, it will reward you. Your health will be better. Your mental processes will be better. You'll age better. Everything improves when you decrease these inflammatory processes. You work on systemic function. Everything upregulates. Everything is improved. Parasites. So again, infections in the gut can absolutely contribute to this. Inflammation from loss of tolerance to foods can do this. So that's a huge part of this as well. Certain medications can contribute to this, like NSAIDs or nonsteroidal anti-inflammatory medications. They all contribute to breaking down of these barrier systems. So this is not an all-inclusive list, but this is a very, very good list that we see tend to include most of the most common reasons. Now, if you're interested in understanding like the approach that I take clinically, if you want a conceptual model, I don't want to like belabor the point here and go through it, but you can just go to our website at drbradshuk.com, scroll down just a little bit and click on learn more. So you can learn about the method that I use to assess, implement a plan, and then reassess and working with people, because you really have to have a systematic approach. You cannot just willy-nilly. I mean, you can. Some people, look, if you're interested in like a trial and error based approach, I think I've got it. I'll share it with you in a second. I'll share with you some things that you can try. But you really, if you're dealing with some of these issues, the best strategy is to get testing done so that you can get the very best starting point, because everyone has bio-individuality. We all have unique factors that drive our autoimmunity. That's why it's so difficult to just try something. You definitely can try things. There are things that you can try, but you can't know what is specifically happening to an individual without testing, because there are too many variables. There's way too many things you can react to immunologically, too many pathogens, too many chemicals to know. So if you can test and identify the specifics based on that, your unique problem, you can really specifically focus on the factors that are driving the process. So one of the things I wanted to talk about was the blood-brain barrier, right? So we talked about how this inflammatory chemistry can open up the blood-brain barrier. And this is a diagram of blood vessels in the brain. And surrounding these blood vessels, there are nerve cells or neurons, and there are some other cells, the astrocytes, which are going to be involved in the immune response. You're going to see pericytes, which are these cells that are on the outside of blood vessels that are actually turn into stem cells if the vessel's ruptured, and they need to signal repair. But the blood vessels have these tight junctions just like the intestinal tract does. So that increased inflammatory chemistry can cause them to open up and again make it permeable and leaky and let things into the brain that shouldn't be there. And the blood-brain barrier, if you don't know what the blood-brain barrier is, it's a filter. Okay, it's just like the intestinal tract. It's selectively permeable, and it keeps bad things out very, very simply of the brain and lets things that are required for nourishment in. Leaky brain, which is really important. And the reason that I wanted to share this is because this is so important because of the prevalence of dementia and neurodegenerative diseases today. Like Alzheimer's disease is skyrocketing. We're seeing it's a much greater rate in younger populations too, 40 to 60 years of age, and instead of, rather than just what we consider like old. It is really increasing in prevalence. And why is that? Well, there's lots of reasons. I've done videos, a lot of videos on this, which I'll point you to some resources if you're interested in looking that up. I've done several videos on the brain, many videos that go into more detail. But leaky brain and this breakdown of the blood-brain barrier is contributed to, it's caused, we've already talked about lipopolysaccharides, right? So from the gut, the digestive tract, can let in inflammatory chemistry that can open the blood-brain barrier. Stress. We just talked about stress and how it contributes to intestinal tract permeability, and then traumatic brain injuries. So TBIs. Traumatic brain injuries have been shown to create permeability. So it's why you hear a lot about professional athletes that have CTE, right? CTE, if you've heard that, chronic traumatic encephalopathy. These guys are when they take and ladies, when they image their brains, they have lost mass. They have areas of the brain where there's significant loss of matter. So it looks atrophied, or it is shrunk, and that is something that is a major problem, because traumatic brain injuries just, it's why my son, he's never playing football. It's just not happening. It's not happening because it's pointless. It's senseless to do that. Anything where you're hitting your head, it just does not make sense to do that. We know too much now. So that's really important to understand some of these mechanisms. And this is the reason, one of the reasons I want to talk about these two systems is because they are so connected. So there's something called the gut-brain axis. This is a real thing. Your brain and your digestive tract are connected by a direct connection by the vagus nerve and the enteric nervous system. So your brain signals the gut through the vagus nerve, and it drives your digestive functions, the production of enzymes, the motility, the churning and contraction of the stomach, the peristalsis, or contraction of your intestines that moves the digesting food through the digestive tract. All that's controlled by and signaled by the brain. And the brain receives signals back up through the vagus nerve as well. But the local chemistry in the gut also contributes to chemistry in circulation. So, we talked about this, where if you have these unfavorable bacteria leaking these inflammatory chemicals, the lipopolysaccharides we talked about, into the bloodstream, this creates systemic inflammation, which affects the brain. So the gut affects the brain not only through a direct connection, the vagus nerve back to the brain, but it also creates and contributes to your systemic chemistry that is throughout the body by the circulatory system that also goes to the brain. So a bad digestive tract can create a lot of problems, as we've talked about. It can break down your endocrine system, your hormonal system, communication, your feedback loops is what we call them. It can create a ton of problems with brain chemistries, as we've talked about, with inflammation and depression. It can cause problems with your neurotransmitters or your brain chemicals, and it's a major factor. So this is a direct relationship. So when you see these things, they're not isolated. Everything in the body is connected. And when there's dysfunction in one system, if you just have tunnel vision focusing on that one system, you're going to miss all these other connections. And what I really try to do with people is look at what's happening to them, get an idea of what's going on, and then intervene as many ways as possible at one time to try to break these vicious loops and cycles that occur. Okay, so that's really critical. So next, what I'm going to do on the next live stream is we're going to discuss environmental triggers. I'm going to go into food protein reactivity, pathogens, chemicals, and stress, which are huge driving factors, right? So we talked about our diagram. We talked about our barriers. Next, we're going to talk about these triggers, and then we may talk about immune dysregulation. Now, for assistance, there are a lot of different resources available for you. So you can go to drbradshuk.com. I work with people around the world, across the country, via telemedicine. You can go to, for self-help programs, you can go to thyroidprogram.com, and you can access our program for literally $1. Give you dietary, lifestyle recommendations. You can if you're a member of that, you can join our transformation community, our private Facebook group, and our supplement, our pharmacy, and you'll get a discount on 20% on all your supplements. A lot of people have been buying supplements for these, that they think might be beneficial for resilience, their immune system, boosting their immune system, and helping with antiviral strategies. And so that would be beneficial for a lot of people that are doing those things. I know I've been buying a lot more than I have in the past. So you can go to thyroidprogram.com and learn about the transformation program. You can also go to FitBody50. Just go to FitBody50, and you can register as soon as we release our app. That focuses on human performance and optimization. We're going to have workout programs delivered through our app. It's really an amazing app. It integrates with a lot of other wearable devices like Fitbits. It also integrates with MyFitnessPal if you're tracking your macronutrients, which I highly recommend. And you can go to Facebook or YouTube, and you can literally look at I think we're close to 400 videos. Okay, so if you want to learn about autoimmunity and your thyroid in great detail, there's a ton of information there that should help you help yourself. So, okay, that'll do it for the presentation. Now, hopefully that is helpful. Do we have any questions that you guys would like to ask, ladies and gentlemen? So let me just take a look at the comments. I'll see what we have here. Just see if we have any. If we don't, that's fine. If you do have questions, you see this later, post them and I'll try to answer them. Hi, Anna. Hope you're doing well. Hi, Karen. Thank you. I didn't drop in the abyss, but I do have to take time for learning and my health. But thank you, though. Rosalind. I was sick last year with a lot of bad bacteria in my gut. I've been trying to clean up my gut. Very good information. Thank you for these videos. You are welcome. Hope it helps. Claudia, you are welcome. Joanne, hi. Hope you're doing well too. So it doesn't look like we have any specific questions, but if you have any questions or anything, please do post them here and I'll try to answer them later. But I do appreciate y'all. I hope y'all have a wonderful night. I'll be working on some other topics. If you have ideas or things you'd like to learn about, post them and let me know, and I'll try to fit it in. But I want to try to give you guys things to help you help yourself. And if you have any questions or anything, let us know. But I appreciate you. Hope y'all have a wonderful, wonderful night, and I'll talk to you again soon. Thanks.